Namaste. This talk is arranged for the awareness of the common people to tell you all that epilepsy is a treatable disease, unlike the stigma that epilepsy cannot be treated or cannot be controlled, and even it cannot be cured at all. Actually, it's not that so. There are multiple new drugs available now to treat epilepsy, and moreover, the modern era has so many new technologies which can detect an epilepsy focus exactly where it is arising from. So unlike years ago, now the treating epilepsy has become a very much easier job for the physicians. But it's a teamwork. It involves a neurologist, it involves a epileptologist who deals only with epilepsy work. It also involves neuropsychiatrist, clinical psychologist, and last but not the least, neurosurgeon. Now, me as a neurosurgeon wanted to tell what exactly the role of we have in treating epilepsies, because I'm sure my prior speakers, Dr. Prabhas, Dr. Arun has told about the medical aspect of it, and as well as the investigations that are available nowadays. Now, this, as I said, that it's a teamwork. It needs to be first, the epilepsy needs to be diagnosed first, and a neurologist and an epileptologist, he diagnosed the focus, where is the focus of the epilepsy. And not that all the epilepsies can be treated surgically, but a handful of them, after doing an extensive workup, it can be treated surgically. Now, there are different surgeries available. That depends on where it is, where the problem is arising from. The one common surgery that we do is called temporal lobectomy, or more precisely medial temporal lobectomy, what is called the amygdalohippocampectomy. Now, the advantage of this surgery is that it controls the epilepsy so well that the need of multiple medications goes down. Sometimes we can reduce the medicine, we can stop the medicine completely. Sometimes it can be reduced to a minimum one drug a day. So this is the advantage of that. And if you work out the cost benefit, a person, if you take his overall lifespan, the amount of money the patient's parents pay for their child is much more than one-time surgery. So this is a definite advantage. And even the neurocognitive functions also improves after the surgery. So it is definitely a much useful for those selected group of patients who are amenable for surgery. There are also, other than this, there are some small lesions we find, which can be small focus of lesions, which is situated in such an area which are epileptogenic. Those areas, if we remove that surgically, the patient is cured of epilepsy. There are umpteen of things to talk about, but this is a brief talk. I just wanted to make you aware that epilepsy is a treatable, and in sometimes it's a curable disease also. Thank you.